All right, after we've presented, our doctor will give us our drug order list. So this has my fluid rates, it has a bag that I should have picked out, and all the different drugs. She will check them off, write them down as pre or PRN. You can see I've already made some notes on some of the rounding. You'll want to discuss this with your instructor or the doctor on how you want to round certain things. Once I have this, I am going to transfer these drugs onto my anesthesia sheet. You want your anesthesia sheet, again, completely filled out as much as possible before you start your drug draw. While you are doing this, you and your assistant can share it, and your assistant can finish filling out your tapes. And this is what they should look like. Drug name on one side, and then the dosage in milligrams and milliliters. So they'll fill that out for you while you're filling out your anesthesia sheet. As far as the anesthesia sheet goes, for the drugs that you know you're going to give the full amount, you can go ahead and write the dose. But drugs like propofol and our intraoperative drugs, bupivacaine and lidocaine, we may not use all of them. So I'm just going to leave the rest of it blank. I do know how much meloxicam I'm going to give though. We're going to do the full loading, which is 1.44 milligrams. So I'll write that down. Now I have it ready to go, so when we give drugs, we can immediately log them and not worry about the name or the dosage being incorrect. So we've already given Serenia. So I wrote the route, I wrote the time, and I put my initials. On top of making sure, getting your tapes ready, there are a couple other areas you want to make sure are finished up in your chart after your doctor's looked at it. This is the checklist you would have made on intake day, which we discuss in our intake video, of all the things we want to do. So make sure the things that have been done are already marked completed, and this animal's PCV and Chem and CVC have been finished. Next, your doctor is going to fill out, or your instructor, and we'll have her sign it as well, is going to fill out the postoperative orders. So this is the form that you're going to refer to when you need to update treatment sheets. So first off, it's going to tell you your non-steroidal anti-inflammatory, whether it be meloxicam or carprofen. It's going to tell you which one we're doing post-op. And this is during recovery, so this will not end up being on your treatment sheets. This should happen before your patient is put away. But everything else after will be for your treatment sheets. So if we were doing tramadol or any other kind of drug, doctor would mark it here on when they wanted it, and you would highlight appropriately. Just as it states in your animal care handout within your guide, if it says night, that's the 10 o'clock treatments. If it says afternoon, that's the 1 o'clock treatments. And post-op is the 6 o'clock treatments. Morning, of course, is 8 a.m. treatments. But that can sometimes be confusing on what time is post-op or night. The last thing I want to make sure I have completed up as much as I can is going to be my surgery sticker. So I have my weight today, so I went ahead and put that. He's getting an orchiectomy. There's his name with client. We've done an ASA. We don't know what tube yet or a catheter, and that's fine. We do know we're inducing with propofol, so we write that. Our gas is always isoflurane. I'm going to go ahead and write in my LRS with the rate and the pre-anesthetics that I know we're using per doctor's orders. And then I'll be all ready to start my drug draw.